Welcome back. You're still watching The Globe. Now, the World Health Organization has declared the outbreak of monkeypox an international public health emergency. It's the highest level of alert the UN Health Agency can issue. The WHO's Director General, Dr. Tedros Ghebreyesus, says that the disease has now been found in 75 countries. He says that 5 people have died, with more than 17,000 cases reported in total.
For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern. And there are now more than 16,000 reported cases from 75 countries and territories and 5 deaths. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
Well, for a little bit more on this, we're now joined via Zoom by Professor Ramneek Ahluwalia, who's a medical expert as well as the CEO of Higher Health at the Department of Education. Thank you so much indeed for joining us, and welcome to the program.
Good evening, Peter, and good evening to everyone. Thank you for having me.
All right, this declaration by the WHO, as described by the Director General, this is the highest notice that they can give about a pandemic. And I just wonder, is it that serious? When I think of the numbers that have been read, 17,000 cases worldwide and 5 fatalities, it doesn't sound like a lot when you look at COVID-19, maybe.
Peter, 2 sides of the story, though, but you're right, actually. See, when a virus, which was always endemic and confined to few towns or few countries in general, a number of outbreaks, which was in, say, single or double digits, a very zoonotic disease means a disease that spreads from an animal to human and with close proximity of humans to those animals, specifically like the rats, the rodents, or even monkeys or animals that have known to have monkeypox, suddenly becomes a disease which has we've seen that the virus has mutated to a level that it's become more transmissible. It seems to have developed now called a human-to-human transmission, exactly how COVID-19 did. It came from bats, or we're still inventing from which animal it actually originated, to the close proximity to humans, mutated itself, liked our human bodies, and started developing something called a human-to-human transmission. And that's exactly how we find ourselves now with monkeypox. 70 countries or 75 countries, it's actually 65 countries which are not in the non-endemic zones, which have now reported cases of monkeypox. Cases are multiplying at a very fast pace in Europe and in the United States and in many parts of the world. So I think for WHO, it's kind of a virus that has spread in international borders, it's cross continents. The virus clearly has shown to be highly transmissible to where it used to be in the past. The virus has shown a human-to-human transmission. So I think WHO is right towards putting the most highest alert to all the countries around monkeypox. Please, everybody needs to be reminded that this virus comes from the smallpox family, which is the virus that was probably the most devastating virus to human mankind, or mankind has ever seen, probably more than even COVID-19, which got eradicated in 1968. And the reality is that we as humans, from last 50 to 60, say from 68 onwards, which is around 50 to 60 years, so anybody who's below the age of 50 and 60 would have never had a smallpox vaccine, giving birth to a new virus from the same generation, finding human bodies with no immune system to respond to it, has now led to WHO coming to that reality. And I think it's important for us to be careful. In South Africa, we have no panic. We only have 3 cases. But as the international borders have grown, as the virus keeps moving, as the virus is mutating, I think it's important for us to understand what this virus is about and how can we prevent this virus, including in South Africa.
All right, so you talked about South Africa, and that was going to be my next question, is should we be concerned? How should the public behave? We're busy just getting used to not wearing masks. Are we going to have to start new sets of precautions?
First of all, COVID still remains around us, though. But monkeypox is not an airborne disease. So the important thing about South Africa for now is no panic. And the most important issue for now as South Africans is to get educated on monkeypox. And I think, Peter, through you, what you're trying to do is ensuring that people get to know what this disease is about. So this disease is not an airborne disease. This disease spreads through a contaminated body fluid. The monkeypox, when it enters into our body or when our body starts showing symptoms, we have the normal viral symptoms like the fever, the body aches, the headaches. But what we also see with this is a rash. The rash starts during the first to the third day of having a fever. And that rash is predominantly seen in the face, in your arms, in your extremities like your fingers, your hands, but mostly also in your genital areas. And because of this rash, the rash starts developing into chicken pox, or in measles, it develops something like pox on your human, which we call them vesicles on our skins. These vesicles have a fluid inside, and that fluid is highly infectious. And that is why one has to understand that physical contact of one human to the other, which allows the body fluid to move. So having sex because of genital area, kissing because of the pox goes into your mouth, means it spreads in the face area and specifically in the mucosa in your mouth. So the saliva can be contaminated with that body fluid, and that's how the virus spreads from one human to the other human. So it needs prolonged association with the human, possibly a physical contact. Important thing is for healthcare workers or cleaners who are using, say in hotels where we are changing bed sheets, towels, because that can have contaminated fluid, and one has to be extremely careful. And that's why the common public health measures of wearing gloves and wearing a mask for those people who are high risk, for example, the cleaners in the hotels, in the hospital, the healthcare workers, they need to take extra precautions for now, knowing that the cases are extremely minimal in South Africa. We have no panic yet, but it's about more of understanding the disease and educating us about what monkeypox is and how it spreads and how can we prevent it from moving from one individual to the other.
All right. So what's the life cycle of the infection, the illness, before it leaves your body? And it looks as if the mortality rate's quite low with this one.
So 17,000 cases, Peter, for now. What we know from monkeypox is that this disease is usually about 5 to 6% fatal, which means out of 100 people, 5 people can be extremely vulnerable. As the disease spreads into elderlies, the disease starts moving into people with comorbidities, pregnant women, very young children like infants. These are high-risk people to any viral disease, including monkeypox. So I think they need to be extremely careful. But the most important thing is, should you find yourself with fever, malaise, it means body aches or headaches with a rash, please report to a health authority, get tested. It's very important to isolate people very at early stages who are showing symptoms of monkeypox. What we can do is we can actually contact trace very, very quickly and contact people into isolation. The smallpox vaccine is 85% effective against monkeypox. It's not something not known. I mean, COVID was new to us, but this virus is known to humans since, say, about 70, 80 years or 7 decades now. So we know how to treat it. The vaccine, if given to the contacts, can even prevent the severity of the infection drastically, which means the person will have a very mild symptoms or even no symptoms. So I think these are very good mechanisms that we have. Currently, there's no panic, so there's no need for us to look into some severer forms of how to prevent this. But I think a smallpox vaccine is 85% effective. It's available. It's known to human mankind, can be produced. And I think it will be once, should the virus move more quickly, or we see the transmission started moving the way WHO is starting predicting for us, then ring vaccinations, ring contact tracings will play a very significant role. This virus outbreak is not like COVID, it's not airborne, so it can be curtailed very, very quickly and can be remaining as an outbreak, not like an epidemic or a pandemic. So I think these are some of the things, Peter, we need to know and how to move. Your first question, it's about 21 days. So when the virus enters your human body, the 21 days are quite critical for symptoms. The symptoms usually can come within the 14 days to the 21 days, and one has to watch the symptoms from there on.
Professor, always good talking to you. Thank you so much indeed. Your insights greatly appreciated.
Thanks, Peter. Appreciate it.
All right, that's Professor Ahluwalia talking to us about this monkeypox outbreak around the world. 17,000 cases, 5 fatalities have been recorded on the continent. So it's not as contagious as COVID-19, but certain people much more vulnerable. And I think the word that's coming through is we must be cautious and diligent in dealing with the monkeypox, and also educate ourselves on how we